The abdomen houses multiple organs, and because of this, abdominal pain can have a great number of causes. Because of this, making the correct diagnosis can be extremely difficult. The history of the patient lends vital clues to the possible problem. Next, examination of the abdomen is a crucial tool in the diagnostic process. In this video, we will discuss how examination of the abdomen is performed and how these different steps can aid in making the correct diagnosis. The first step of the examination is inspecting the abdomen. On first glance, this may not seem that helpful. However, the trained eye is able to make many observations. Bulges can be spotted, indicating a possible herniation, scars from previous surgical procedures, or injuries can be seen. Enlarged superficial veins can even suggest liver cirrhosis. After inspection, the following step in examining the abdomen is auscultation. With the use of a stethoscope, the sounds of peristalsis can easily be identified. The frequency of detected bowel movements can aid the diagnostic process. For instance, a high frequency can be observed in the case of gastroenteritis, and a low frequency of bowel movements can be heard during constipation. An elevated pitch of bowel movements can even point towards a possible mechanical obstruction of the gut. Locating the precise origin of sounds produced by peristalsis is difficult, because different parts of the digestive system are too closely related to each other. Instead, auscultation provides a general status regarding the activity of the gut. Next is percussion of the abdomen. This is a technique in which sounds are produced by placing one hand on the abdomen and tapping one of the fingers with the other hand. By doing this, a percussive sound is produced, through which the underlying structure can be determined. Solid organs, such as the liver, produce a dull sound. A tympanic note is heard when an air-filled space, such as the stomach, is percussed. Percussion enables the clinician to gain information about the size of organs, such as the liver and the spleen. Some pathologies, such as ascites, in which fluid accumulates in the peritoneal cavity, produce a profound dullness. Other pathologies can produce a profound tympanic note. Dangerous examples include perforation of hollow organs, but something as simple as intestinal gas could also produce a tympanic note. The final step of examining the abdomen is palpation. Palpation is performed last to locate any abnormal palpable masses and to identify any possible painful areas. The location of pain during palpation provides vital clues to the possible cause. Rebound tenderness is tested by applying pressure to the abdomen and then rapidly releasing the examining hands. This action will vibrate the abdominal wall, and in the case of an inflamed peritoneum, this will provoke pain. When other symptoms suggest a possible problem, additional tests can be performed. For example, when the pathology of the gallbladder is suspected, the gallbladder is palpated during inspiration. Because of the inspiration, the gallbladder will move more inferiorly. During this action, a tender gallbladder can cause a worsening of pain, known as a positive Murphy sign, pointing towards inflammation of the gallbladder. The four steps, inspection, auscultation, percussion, and palpation, make up the examination of the abdomen and provide the clinician with a wealth of information. This examination, together with the history of the patient, can sometimes even be sufficient to make a correct diagnosis. But even if a diagnosis cannot yet be made, this systematic approach will provide further clues to further investigations.